Like most other states in the country, Virginia is seeing a rise in COVID cases and hospitalizations. And with the vaccine's approval expected soon, the state is set to receive nearly 500,000 doses by the end of this month. Virginia's Governor Ralph Northam is also a physician, and he joins me now. Governor Northam, thank you very much for being with us again. So tell us, how is Virginia doing with regard to infections, hospitalizations, positivity rate?
Judy, thanks so much for having me. We are seeing upward trends of our number. Our positivity rate, which we follow closely, is now over 10%. There are some areas of Virginia where it's even higher than that, especially out in our southwest. We took some aggressive actions prior to Thanksgiving to mitigate these numbers. Obviously, we have the Thanksgiving surge that we are concerned about. We are probably seeing some of that beginning now. And we're having further discussions, Judy, on whether we should take further measures to mitigate these numbers. So a lot of that is in discussion, but we're very concerned, especially our hospital capacities through Virginia. For the most part, they're doing well, but certainly in the Southwest, we're seeing a decreased number of beds, and also our staff, Judy. And that's across Virginia. Our staff has been doing just a wonderful job now for 10 months, but they're very tired. They're fatigued, and we need to take that into consideration and make sure that we protect them. And we continue to encourage Virginians, and for the most part, they've been doing a good job to follow the guidelines of the wearing the facial protection, washing our hands, not gathering in large groups. So those are the things that we're doing. We're anxiously awaiting, like all governors, like all states in Virginia, the vaccination. Two companies, as you know, are very close to receiving approval from the FDA. We've been told that we're going to have 480,000 doses, which will cover our frontline healthcare responders and providers, and also our long-term care facilities, both the residents and the staff. So we're excited about that, but we know there's going to be a couple of months at least where we need to keep these numbers down and keep that curve flat.
So you're saying the people who will be first in line for the vaccine once you get it will be your frontline healthcare workers, and then individuals who live in long-term care facilities, nursing homes, and so forth. But what about beyond that? I mean, when you look at essential workers, people who are over 65 years old, I mean, that's a lot of people. How will you make decisions about who gets the vaccine first?
Yes, it's no doubt going to be supply dependent, Judy. And, you know, we're looking at teachers. We want our children to be back in school safely and responsibly. Our food preparers, those individuals, as you said, that can't work virtually from home. We've really got to make them a top priority. So we have 3 phases, and we're following the guidelines of the CDC. But we really want to get to this first phase, and then as the supply will allow us, get to these other individuals as well. And we're confident that if the supply is there, I mean, we've been preparing for this for months now. And certainly as a physician, I have experience in doing this in the past, working with vaccinations. And so we're confident that by early to mid-summer, all Virginians will have access to the vaccination, which is really encouraging news. There's finally some light at the end of this long, dark tunnel, and we're all really looking forward to that.
Governor, the other thing I do want to ask you about is legislation you signed several weeks ago, modeled around so-called Breonna's law, banning no-knock search warrants, of course, after the case of Breonna Taylor, the Louisville, Kentucky young woman who was killed by police in her own home. This makes Virginia the 3rd state to pass this law. How do you see it changing law enforcement in your state?
You know, this was a somber day for Virginia, but it was a necessary day. And what a tragic loss of Breonna Taylor. And her family was with us today in Virginia, and just had the opportunity to sit and really hear their story. As you mentioned, we're the 3rd state to have a no-knock warrant law. We're actually the 1st state to sign into law in response to her death. So this is important. You know, it's time that we as a society do more than just talk about these tragedies, and it's time to take action. And that's what we chose to do. I called the General Assembly back into special session in September, and they took up a lot of measures with police reform, such as decertification, co-responding when there's mental illness, better training for our police officers. And, you know, as I made the point today, this is not about being anti-police, it's about being pro-people. We need to make sure that we treat people civilly across our Commonwealth. And so today, to be able to sign Breonna's law into law was a good step for the Commonwealth of Virginia. And I would hope that other states follow suit.
And finally, Governor, law enforcement organizations in Virginia, are they accepting this? Are they this and your other moves to reform policing?
No, we've had a listening tour in Virginia, Judy, and I like to say the more I learn, the more I can do. And the police forces were at the table, as well as a lot of community activists, a lot of the protesters that we heard from, especially after the tragedy in Minneapolis. So we all worked on this together, and they couldn't have been more cooperative, and I think they agree that we needed to make changes, and this was certainly one of them.
Governor Ralph Northam of Virginia. Governor, thank you so much for joining us. We appreciate it.
Thank you so much for having me, Judy.